Welcome to Cancer and Peace. My name is Sean Stewart, and I'm here with my good friend and buddy, Peter Scalzo. He does have socks all the way up covering his legs, so that's a good thing as we start our episode today. So I know that's our running joke here. But we're going to talk about a topic that is something that I think he's going to be able to help a lot of us out with, because sometimes it's hard to know how to interact with somebody who's going through a cancer journey. And so you get asked a question all the time. When I go to visit somebody who's on their cancer journey, maybe in the hospital, what do I do? And what should I say? How do I interact? And so today is more like a helpful thing, and it may be for caregivers or friends. But if you're on a cancer journey too, I think you might appreciate just hearing some thoughts from somebody who's been down this road and had lots of visitors through the years. Maybe you can even throw in, how do you respond to when somebody's not exactly appropriate? Maybe that might be an interesting part of this too. But I'd like to hear your thoughts too, because I'm interested, as all of us. We've been in these situations where somebody's on their journey and you're going to go visit. What's a great way to interact?
I mean, it's really one of those areas, Sean. I think we were saying before this podcast that I think it's my most frequently asked question is, "Hey, I have to go visit this person in the hospital, and this is what's going on with them in their cancer journey. What do I say? How do I act? What do I do?" So, and it's one of those areas where I've had now 17 years of being in the cancer world myself, but also going in and doing many cancer journeys with many people, from diagnosis to end of life, survival, whichever happened, and had to interact many times in the hospitals and in hospice facilities and in lots of different venues. And so the issue is, what do I do? What do I say? And I can only respond in my limited space of my own experiences, and also those times that I've done visitation with pastors, pastoral care pastors, and listening to them, what they say, because there's people out there that are actually trained in this area.
Yeah.
So I can just say what worked for me and what usually works for when I'm with someone. And I think the first question to ask yourself when you're faced with this is what's going on with this person? And, have they just been initially diagnosed? Am I calling them for the first time after hearing, hey, such and such has cancer? And so a lot of people avoid that person. They don't reach out. And I think it's because they're scared and they don't know what to say. They're intimidated. It's not that they don't care. But one of the issues, interesting that I'm even mentioning this, one of the issues is that the cancer patient feels like the person doesn't care if they don't hear anything. So it's like this two-edged sword for the person. Like, I want to reach out and talk to him, but I don't know what to say. And for that kind of a thing, and really for the whole process of the cancer journey, and we mentioned this in our podcast with April, and if you get a chance to listen to that podcast episode, that'll be wonderful. But April is a cancer survivor who came on this program and was interviewed by Sean and myself. But it's to send a card. As a cancer patient, no matter where you are in the process, to receive a card is an incredible gift. Because it is something you can hold in your hand. The person took the time, the energy to actually select a card and write in it any note, even if it's just a scripture verse or a praying for you. I'm sorry to hear of your diagnosis. I'm wishing you the best. Whatever words of encouragement, but just the fact that you were able to go out and make that happen and send that card, that can happen at any point during the journey. And
April did, though. She talked about, this was good. I'm glad you mentioned her, because she talked about getting over 100 cards, I think, from her coworkers, if I remember right, and that. She went back to them, that it was really meaningful, that you may feel like you're, just a card, but she went back and reread those cards from her coworkers, and it brought such great encouragement to know that she was cared for that much by this group of people.
My first surgery at Sloan Kettering, I was down in the city in Manhattan there for, 20 something days. And I received a whole stack of cards that people had brought down to me. Here's the cards that came in the mail, and I read and reread them and kept them on my table. And how I described them was, this was food for my soul. This was soul food. And so that's how I think you should think about that. And sending that person a card is just, this is food for their soul. This will encourage them.
I'm going to put this in the bucket then. I'll maybe put titles around this a little bit, but it's recognizing the power of community, that a cancer patient needs to know that there's a caring community. And so it's not a fix. It's they're not alone.
And I think, now that we're in the age of texting and emails, I think personally a card carries a little bit more oomph than an email and a text. A text is nice. I've received a lot of texts from folks who heard about a recurrence or a surgery, and which was fine. And it's great to hear from anyone. An email too, but a card has a shelf life and it's something you can hold. And you're smiling.
I was just thinking it's almost like I'll put a comparison out and see if it fits. It's sending happy birthday to somebody versus text versus getting a card.
Yeah,
it's at that level of weight, because happy birthday by text is cheap and easy, right? To get a card means I took time to go out and find one or build one, and I hand wrote something on it, and I put, some postage on it, or I hand it to you in person. I took time to get it there. It's quite a bit different than the ease of, it took me 15 seconds to write happy birthday in a text.
Now, I'm not, and thanks, Sean, that's right. And I'm not, obviously, if the cancer patient is your family member, your spouse or whatever, that's a different conversation than we might have right now. But this is if, it's a friend, it's an acquaintance, it's even a relative, but maybe not someone that you interact with on a daily basis. What do I say? What do I do? And
am I supposed to bring something with? So if I go to the hospital to visit somebody, am I supposed to bring something with me, or is my presence the gift?
So that's the issue, is when visiting someone in the hospital. I'm pretty emphatic about this. It's to be super sensitive on where they are in the process. For instance, I've had 15 surgeries where I've had overnight stays in the hospital. And other countless nights in the hospital, even without surgery, just different issues related to the cancer journey. But where I've been there, some of my surgeries, I've been a month in the hospital. Now, the issue for a cancer patient is energy, fatigue. Fatigue can be huge. And so if you're going to the hospital and the person has just had surgery, or is close to that point where they've had surgery, let's say within the first week, if it was a pretty serious operation, invasive, or at least within the first few days, a visit should be like 10 minutes at the most. I've had anywhere from great visits to not great visits. And I had one visit where somebody took out their laptop and proceeded to spend 2 hours while I was in bed and sleeping off and on and looking at me. That's not a great visit. That's not very helpful. And you talked about, should you say something? And I think, depending on where you're at, but I believe that it's helpful when a patient does draw the parameters of the visit to the person, but a lot of times they won't, because the cancer patient is just hurting, first of all, and maybe doesn't have that personality that they're really direct and honest about where they're at. And so it's really up to the person. It's incumbent upon them to sort of say, okay, I'm going to go in there. This will be a very quick visit, 10 minutes. And then the issue is...
but speak to the cancer patient before you go there. Yeah, so what should they... Because I think there's probably some... How would you advise the patient, though, to interact? It's like... give some words of wisdom.
Yeah, it's to be direct and honest. It's to... If you're really... Like I've told people, this is not... I even had the staff tell visitors, I don't care who it was, no visiting allowed.
Yeah.
I was in too rough of a place and did not want to see anyone. And that should be respected. And it's not meant to be a criticism, or it shouldn't be taken personally. It's just as that cancer patient is under extreme pressure at that point.
So I think what I hear you saying is
yeah,
communicate your boundaries,
yes,
but describe them as boundaries. I need this. And so
correct.
if you are having visitors, it's, hey, I'm grateful you came and you took the time.
Yep.
And 5 minutes is probably all I'm able to manage right now. So let's do that 5 minutes.
Yeah, except yes, that's true, and it's most cancer patients don't have the benefit of hearing an episode like this, and so they won't actually communicate that parameter, that boundary.
Yeah.
And so it's incumbent upon the person visiting to be sensitive to, hey, 5 to 10 minutes of something, I'm going to make this a very brief visit. I even do short visits like that with people who have been in the hospital for some time and are even home. It's one of those sensitivity things where you watch the person, you say, okay, well, I just want to stop by for a quick visit. Oh, please stay. If the person wants you to stay, they'll say that to you.
Okay.
Because you are there for them. You're not there for yourself.
Let them ask, because I think you're
yeah,
saying.
And as a visitor, you're not there for yourself. I think that's important because I felt like sometimes I would have a visitor who I felt like they were there to like throw a scripture verse at me or just kind of get something off their chest that they wanted to say. And it's like, how about just sitting next to me and smiling and maybe being quiet for just a little bit. You know what I mean? I don't mean to come off as being mean right now, but just for the visitor to be sensitive. I get this question quite a bit, and what I tell people is a very short visit and a prayer is always usually welcome, whether a person is a person of faith or not. A lot of times you can say, "Can I pray for you?" And that person appreciates that gesture. It's really a gesture of love. And so that's something, but there is no magical words that have to be said. There is nothing special. Your presence alone is the gift.
That was the word I was going to say. Presence is what I'm hearing.
Is the gift.
Presence is a gift.
Yeah. So there doesn't have to be a special Bible verse or a special exhortation or anything from the visitor. It could just, in fact, I have visited cancer patients before and just sat by their bedside, and if I sensed that they wanted a touch, to hold a hand or something, but not even to say anything.
I'm going to ask for something even more. So the disciples asked Jesus to teach them to pray.
Mm-hmm.
What would you think would be a great way to pray for a cancer patient when you go into their room? And I've had some of these. I've been at a hospital where they're shared. Maybe you're in with another person or something like that, and so they're listening to all that. It's to people. What's the right way to pray for somebody who's in that space?
Yeah, that's a great question. I think it's what I appreciate. I'll talk about from my own perspective. It's prayers of comfort and peace and hope. Prayers like gratitude, thanking Jesus for this moment, and which is totally appropriate. Thanking Jesus for His presence, and also even praying for healing is fine. Asking the Lord for full restoration, healing, all that. And any, those kinds of prayers. Is that what you mean? Like what to pray for in that way? Or was there anything in particular, Sean, you were thinking about?
No, I'm just interested in sometimes, so I'll ask the question from a different angle too, is, do you feel like sometimes people come in with false hope?
Oh,
and then they pray false hope, or they interact in false hope. Is what's your experience with that? Because I'll give you like
Mhm.
if somebody were to come in and say, "Oh, Peter, everything's going to be all right," that type of thing, that seems like that's where I feel like might be, if I'm in your position, feels inappropriate. But I would like to hear your perspective on this.
For me, that's empty. That's just an empty, because I have had so many times people tell me and declare over me that something would work out a certain way, and it was the opposite. And I don't want to go into all those examples, but I have a lot of them.
Yeah.
And so I think it's more of a humble kind of a presentation about, I mean, my personal view on healing is that I don't know if God wants to heal a person physically. I'll ask for healing, but I'm certainly not going to declare anything or like make a promise or anything like that. But I think the more it's, you know what, it's how can I be loving to this person? What does loving this person mean? And like you said, false hope or empty promise, that's not loving, I don't think. But loving is to center it on them and to be a quiet presence. And you're not there for yourself. You're there for them. So let's say the person, you get there, you poke your head in, and they go like this with their hand and say, "No visitors." Don't take it personally.
Yeah.
They love the fact that you came out. The cancer patient loves that fact. But right now at that point, maybe they're nauseous. I have been in the hospital for 30 days without food because my intestines wouldn't wake up. So, and I felt nauseous most of that time. Mm-hmm. So to have someone in my room, if the cancer patient feels like they have to entertain someone, that's an issue. It should be a total gift of that person coming in. Going into that person's room, let's say, and weeping over their bedside, that's not helpful. As a cancer patient, to see concern from someone, that's fine. You want to respect and let that person show feelings towards you, but they don't need to mourn over your bed, And obviously, I'm not talking about an actual end of life thing, but even in the end of life process, they don't need to have someone come in and just sort of weep over the bed. That person. What I wanted to see as a cancer patient, I wanted people to come in and bring life in with them, speak life. And what that meant is, what's going on in your life? Tell me. How's the job? What's the relationship going on? Provided I had the energy to ask and hear.
Yeah.
Because I didn't want to entertain them. I wanted them to come in and just, I've had visits. I can think of it right now. I've had visits in hospitals which were incredibly helpful, and I've had visits which were very difficult. But the helpful ones for me were soft, meaning the person was soft, was patient, listened, helpful, knew when to leave. There's a sensitivity there. And
so I think I hear you really asking someone to read the social cues, come with this idea of presence, read the social cues, and make sure to keep it as pithy as possible related to that. But there's not a scenario out there where it's come hang out with the laptop for an hour ever.
Yeah, ever.
Or your smartphone. Ever. I mean, just go scroll while we're sitting here.
Yeah. I mean, a family like my after 2000 my 2015 surgery done in Manhattan, and I've talked about that a lot. My kids started to stay with me overnight through my whole cancer journey until
we're not talking about families, but you're really saying yes.
Yes, and my children, having an adult children by my side, we wouldn't even talk. And yet, what a comfort it was. It was a feeling of home, family, love, connection, even though there was nothing being said.
You're speaking of friendships and as a friend caring on these kind of, I'll call them guidelines or ways of thinking about this. That's good. I was just reflecting on, it was just a few months back. I was part of an end of life journey, and I was there at this friend's hospital bed in their last day of life, but they weren't
Mm.
conscious. They weren't, and so there was a little bit of awkwardness because when you talk to somebody who's not consciously present and interacting, what do you do? And
Mhm.
it didn't feel respectful to pull out the smartphone and even though you know there was a level of lack of interactivity,
Mhm.
and so I just shared some thoughts about our friendship, and I read a small passage that I thought
Yeah.
was kind of a cool passage that I was reflecting on at that point in time,
Mhm.
and prayed real quick, and that was it.
Yeah.
But it was still there was a level of awkwardness
Mhm.
because um, it was clear that without conscious interaction, how do you relate to that? And I don't think that's what you're trying to speak to as much
No.
about an end of life journey as you are
I mean,
somebody who is
yeah.
conscious, and how do you
Right.
respect and
Right.
interact with that time?
I think the end of life journey we should do another time. And
Yeah.
when a person is non-responsive, I still think perhaps hearing and the soul is awake. Still, things are awake still, even
Yes.
though they can't respond. So, like reading a scripture that's appropriate and speaking to them about life. And lots of times I've told loved ones, everything is fine here on earth, and we just want you to be in a place of complete peace and rest. These were believers, so it was when you see Jesus, run to him, that kind of thing. Encouragement, that kind of thing. But that's for end of life, end of life. But yeah, I think like I ministered to a guy in his 50s who was passing from cancer, and he was still cognizant and everything, but he wasn't going to leave the hospital. And we, I read him just about an entire book called Imagine Heaven.
Mm.
But he wanted me to. He asked me to. He handed me the book and said, "Read this to me." So I would, every time I visited him a lot, and I would read a chapter usually. And he loved it. He would close his eyes and just listen. As soon as, sometimes he went to sleep. Most of the time he stayed up. As soon as I was done with the chapter, closed the book,
Yeah,
whether
that's
his
great.
eyes were open or not, love
Yeah.
you, and just leave.
Yeah, I definitely think we should talk about end of life at some point. I've
Yeah.
got my own experience with a close friend that we went through this, and I
Mhm.
remember he had given me at some time back his favorite songs, and so I just had
Mhm.
my ear pods, and I would put one in his ear, and we would listen to
Beautiful.
that together, and it was just an amazing,
Yeah.
just experience to
Yeah.
let him. I had no idea what he's comprehending, but to share something of his passion in that period of time felt, like the appropriate way of interacting.
Mhm.
There's probably a lot to share in that space. But today's is really more about friends and somebody who's in the hospital or who you're going to interact coming, they've been home from the hospital, and how do you interact with them? And so I hear up front, don't ignore.
Mhm.
Even if it feels painful, lean into that pain a little bit because it's
Mhm.
important that they sense community and know they're cared for.
Mhm.
Respect where they're at in the queues and try to
Mhm.
keep it as short because energy
Mhm.
is low.
Mhm.
And then you're gonna go from there to trying to understand where they're at and what
Yeah,
they need.
if they have their energy back, the cancer patient, and I still think sensitivity needs to be shown as to, don't think because a person seems energized that you can stay for 2 hours,
Let them ask is what I heard you say, which I
Exactly.
thought was a great piece
Yeah.
of advice. Let them ask
Yeah.
for more if that's what they want, but assume
Mhm.
that it should be relatively short so that they can rest, but your presence is the most important thing.
And I think it's, what I liked, I appreciated, people who were upbeat. I did, even though my prognosis wasn't good. I didn't want to be around, somebody who was like depressed about my situation. I
Yeah.
wanted to be around someone who was like, okay, okay, well, let's move on. We're gonna, when are you coming home? What's going on? And more upbeat.
I like that. I think I can connect with what you're saying, just related to don't bring a dour personality, and that's hard to.
Correct.
You don't need that when you're already
Right.
at a place of deep struggle.
Yeah, it doesn't have to be fake, but just there's a Toby Mac song where he says "speak life" into it. It's that kind of thing. Like there are ways to speak life into a cancer situation.
And if you can't do that, send a card. Sorry.
Any cards are great at any point. And also, I was just going to mention, there's always practical ways of showing your love. For example, my wife, who went through this cancer journey for me for so many years, people would bring her meals. We had 6 kids, and so wow, that they would bring. I'd be in my bathrobes with all my tubes, home from the hospital, and they would bring a meal in and wave to me, and I'd be like, "Come on in," or else I'd wave back or whatever if I didn't feel like I could visit. But that gesture of bringing a meal over is huge.
Showing care to the family and those around is big. I like that.
Yeah, huge.
A gift of hospitality.
Mm-hmm.
Those are pretty good suggestions. Anything else you want to throw in there before we close out this episode? Just of
no, because it's such a facts and circumstance kind of thing.
Yes.
It's really where the person's at and your relationship with them. So,
yeah, knowing whether or not this is more routine or an end of life, or where that person's maybe brand new in their cancer journey versus for you've been through a lot of surgeries, and so this week or next week you're going to go in and
surgery again,
and you're going to have surgery, and you're not expecting a card from me because this is more routine for you, and but you probably do hope that somebody asks, "How are you doing?" and what's going on in your journey.
And I think back to, I don't want to embarrass anyone, but one of my very first cancer surgeries where I was in the hospital and I woke up and there were 3 people at the foot of my bed who I really didn't know. I mean, I knew of them, and it was almost like they were watching me, like, Peter's a cancer patient now, because this is when I was initially diagnosed, and it was a little weird.
You don't want to be a zoo exhibit.
That, and like where people just stare, and if it's someone you sort of know vaguely, don't visit. If you have a relationship with them, great, but
yes, I get it.
You know what I'm saying?
Yeah, know where you're at in your relational
Yep.
with close friends. Be there. If you just know about somebody, or it's a casual every now and then relationship, send a card.
Yes.
I like that. That's good. I mean, I know this is really practical,
practical.
type of a podcast episode this time, but I think sometimes we do struggle with how to interact. And as cancer patients, you're giving your experience. You're not some people are going to have a different view on this, but I think these are really good practical things to read the cues on and understand. And I think it's helpful for all of us as community to know, how to be helpful, to that a cancer patient needs community, but it doesn't need an overbearing community. And sometimes in our own heart, we know whether we're doing it for ourselves because maybe we have a conscious, well, I probably should do that, but I don't really want to have to do that. And hey, I really care and I want to actually interact with this person because I care.
Right.
And I want them to know it.
Yeah. I mean, a lot of people are uncomfortable interacting with someone in that space, and that's where cards are great.
Well, there is something to be said, and we'll close out with this little last topic, but it is leaning into the discomfort and pain, because that's where deep relationship is at, is the ability to enter into somebody else's pain. And so I think what we're talking about visitation and interaction is, I can't experience your surgery, but I can lean into your emotional pain. And I can do that by showing up and being present and feeling a bit of what you're feeling for just a few minutes. And it's a way of absorbing pain from others. And that gives you more capacity to deal with the pain that you have when others come around in community. When we absorb people's emotional pain and we enter in with them, it opens their own capacity up. It's as if we've taken some of the pain off of you. And I know this is like very psychological sounding, but there's a real something to taking and bearing one another's burdens together. And I think that's what you're talking about. That's the importance of this. And as part of the journey to peace is working through community. And so we're trying to talk to people about how to live in community, because peace comes as we recognize we're not alone, and that some of our pain can be absorbed by others, and our spirits can be lifted. And there's joy in that, even in great pain of a hospital visit and stay.
That's right. I love it.
That's the bow, huh?
Yeah, that was great.
All right.
Thanks, Sean.
Well, we'll put a bow on this episode,
Yeah.
and I thank you for sharing a bit of your own journey there.
Sure.
I know this may be really a practical type episode. Sometimes we talk about a lot of theory and concepts, but today was really about, hey, there's a lot to how do we interact in community, and what can somebody who is thinking about how to care and be involved in someone's life, how do you do that? And so this is it. So if you want more resources on Cancer and Peace, go to our website, cancerandpeace.com, see Peter's book, see resources from emotionally healthy spirituality to Wild at Heart to Celebrate Recovery. There's a lot out there. Check them out. And there's even streaming episodes from some of our history. You can click and check out a lot of what's going on. So just thanks for listening today.
Thank you, Sean. Appreciate it. Blessings.